Noted Dr. Dentist, Dr. Gregory An and Dr. Lisa Thompson. Thank you so much for being with us.
Thank you.
You know, the demographics we read so much about how there's just so many more and more older people that are coming up.
It is a huge issue. It's a public health issue. We know that there are a lot of older adults, and they're going to be increasing in numbers, and they're healthier, including their oral health, which means that they're keeping their teeth longer. And so it does present a unique situation for the oral health provider. And there's also another thing I want to address in terms of your question is that there's also a disparity of care as well. Even though there's going to be an increase in the number of older adults, it's not all equal. And so what we find is that there are some major differences in terms of oral health status amongst minority groups and older groups. So if we're looking at older adults versus younger adults, older adults tend to have a lot more problems, but they see their dentist a lot less frequently. So that presents a big problem. And there's a number of reasons why that occurs. One of the major reasons is dental insurance. Most people lose their dental insurance after they retire from work, which leaves them having to pay for dental services out of pocket. And so that's a disincentive for a lot of older adults to seek dental care. And if we look at specifically older adults, amongst older adults, there's also a disparity of care. Now, I just talked about younger versus older. Amongst older adults, there's a big disparity of care amongst minority groups versus non-minority groups.
Is that because of where dental practices are located, or do you have any cues on why that is?
That could partially be it. It could be a cultural issue where they prioritize things differently. Something that we don't quite understand completely as of yet. But what the data show is that minority groups, including Hispanics or Latinos, and also African Americans or blacks, is that they tend to have worse oral health. Ethnic minority groups tend to seek dental care half as frequently as non-minorities, so non-Hispanic whites. And so that's bad enough as it is. However, to add to that, the ethnic minority groups are twice as more likely to have oral health problems. And there are unique ways to sort of battle this situation. One is something that we talked about earlier, is that there are going to be less amount of dentists over the next few decades. You want to have perhaps other people who could also act as gatekeepers. So you can have physicians, nurses, other non-dental healthcare providers who can just basically look at things visually to help identify problems early.
Do doctors look inside a person's mouth enough?
I think doctors tend to look beyond the mouth into the throat, into the oropharynx. And so we're trying to, with our program at Harvard School of Dental Medicine, working with physicians and psychiatrists to also inform them and teach them to look in the mouth and to do the oral examination, retracting the cheeks, to look inside the mouth before they go beyond.
So that would kind of progress or involve nurses and physicians' assistants as well.
Absolutely.
Isn't there also a feeling of among people that, well, I'm just lucky to have my teeth this long and I'm going to lose my teeth anyway? Is the loss of your teeth a natural process of aging?
The loss of teeth is not a natural process of aging. And we encourage people to keep their teeth also because dentures, if that's an alternative, they don't fit well without having teeth to help hold them in place. But the loss of teeth is not natural. It's a cause of disease that would cause somebody to lose their teeth due to periodontal or gum disease or due to caries or cavities.
The knowledge that we want to disseminate to people and other healthcare providers is that it's preventable. You want to prevent the loss of teeth and prevent the diseases that occur that lead to losing your teeth. Preventive measures are usually cheaper than if a patient comes in with emergency care. So if a patient comes in with an emergency care, it will likely lead to extensive dental procedures, which can be very costly and can add up pretty rapidly. which can ultimately lead to tooth loss because patients will choose to extract the tooth rather than pay for services, which then eventually lead up to dentures. And one thing with dentures is that dentures are a substitute for no teeth. They are not a substitute for teeth. And so it's a little bit better than having no teeth, but it's by far worse than having your own natural teeth. So it should never be an end goal for anyone to think, I want to get dentures. It should always be, I want to keep my teeth.